Welcome to Home Health 360, a podcast presented by AlayaCare. I'm your host, Jeff Howell, and this is the show about learning from the best in home health care from around the globe.
Welcome to another episode of the Home Health 360 podcast, where we speak with home care professionals from around the globe. I'm your guest host, Erin Valier, U.S. Director of Sales for AlayaCare Software, and today I am joined by rock star nurse Lourdes Wiley from Amity Healthcare Group to talk about a topic that is super relevant as we all approach the new year and we find ourselves in this mode of trying to create the conditions for a fresh start and setting some really important goals. Now, Lourdes has 20 years of experience as an RN. She started in adult and pediatric critical care, and then in 2006 decided to take her career out of the acute care space into a more diversified path, including leadership and education. She has experience in home health, hospice, and nursing education, which uniquely positions her to speak to us today about burnout and compassion fatigue. Welcome to the show, Lourdes.
Hello, Erin. Thank you so much for having me yet again. Pleasure to be here.
I am excited. And this is your second appearance on our podcast.
Yeah.
So I'm guessing, or I'm hoping at least, that some of our listeners are already familiar with who you are. And if they're not, everybody listening, you got to go back and listen to episode 14. And that's where we were discussing nursing competency programs. But I'm sure everybody would love to know what's new with you, Lourdes, and what's new with Amity Healthcare since the last time we spoke. Can you give us an update?
Yeah, it's been, an exciting year. We were keeping up with the competency program and trying to serve clients that way, as well as with our consulting services that we have for agencies trying to get licensed, certified, accredited, out of trouble, all that good stuff. We are actually really excited that our competency program is currently being reviewed by ACHC, and we may be getting an endorsement from them, but they're taking a serious look at it, as well as some of our other products that can help agencies, such as QAPI programs, admission packets, things that help agencies kind of not have to recreate everything, especially small to mid-sized companies. So that's exciting.
That is super exciting.
Super exciting. We authored a wound care program, and we're working with CHAP actually on this one. But CHAP has some disease management certifications open to folks who maybe are accredited with them or not accredited and just want that CHAP seal of approval, so to speak. So we crafted a program for agencies that might be interested in seeking that wound care certification. And we're hoping in 2023 to really put out some good courses and competencies that can match that. So whether agencies want to get the certification or they just want to up the quality of their wound program, which is always a big thing. We have that going on. And then I'm excited to be here on this topic because it's kind of my passion project, Erin, and I've been doing a lot of public speaking on burnout and compassion fatigue. Every chance I get, I've done some webinars with ACHC. I went to Florida to speak at their home health conference. Any chance I get, kind of. And I'm even helping some local clients through workshops and education and support with that. So that was a mouthful, but you asked. So that's what's going on.
There's a lot of really exciting stuff going on. And in case the listeners didn't catch it, you are getting special attention or recognized by ACHC and CHAP. So if they are accredited or they're seeking accreditation, they should come talk to you guys. That's my takeaway.
Yeah, we would love to help them with. And also Oasis E is looming, speaking of burnout and challenges. And so we're happy to help with that too, from a support with our coding and with our documentation review and anything we can help customers with that, because we know that that's a big stressor with all the changes coming. Yeah, so lot going on.
So many changes. Well, thank you so much for the update. Now, you shared with me a little bit about burnout and compassion fatigue prior to this episode, and I did a little bit of research on my own, and wow, it's a big issue. You shared with me that burnout and compassion fatigue are the leading causes of healthcare workers leaving their jobs and leaving the profession altogether. And that was pretty much in alignment with my research too. You also said that, this is disappointing too, that the solution has historically been addressed as an individual's problem and not the organization or a systemic problem. Now, you're clearly passionate about this topic. Why is this area of focus so important to you?
Thanks for doing your research, because I think part of the disconnect is, we're all going to be patients. So why is it important to me? Because I'll start with my professional side. We're all going to be patients. You, me, our loved ones, everybody, right? Like it or not, even if I know you're super fit and healthy. I try to stay super fit and healthy. Eventually, you're going to be a patient. Your body's going to fail you. We're all going to die. I hate to be morbid, but it's true. And so sometimes I think when we're not in the system as a customer, as a patient, or we're not a worker, people don't realize how bad it truly is. And so professionally, it matters to me because I see the detriment. I see what it's doing. And we'll talk a lot today about, I pulled a lot from what's happening. Our Surgeon General has actually made this almost like a national emergency. So a lot of my data comes, you probably found this in your research. The Surgeon General has a call to action and a whole advisory out on this. And the National Academies of Medicine started sounding the alarm in 2019 before COVID hit us. So professionally, after 20 plus years in healthcare, I could make an analogy that when I started nursing, I already saw the system kind of as maybe a middle-aged patient that is not taking care of themselves. You see them going towards that disease. You see them doing all the wrong stuff. They're smoking, they're eating bad, they're stressed out, right? And over the course of 20 years, I'm watching this 50-something patient decline now to a 70-something-year-old who's now ready for ICU. That's how sick our system is. And so it's a whole problem, which is why we're going to talk about why it's not just an individual thing, because I could go meditate all day. We can all take care of ourselves. It's not going to fix it. So professionally, I see it for what it is. And it's actually a global emergency right now, Erin. I mean, we're seeing strikes in the UK, nurses are burnt out and done there. But so professionally, awful because it's just not good for anybody. It's hard to work in. And that's why people are leaving, because it's affecting their physical and their mental health. Personally, I've dealt with burnout and compassion fatigue the day I started, but we didn't know back then, all that we know now. We didn't prepare ourselves for the hardship that it is sometimes. And I went straight into, pediatric hematology, oncology, and critical care with kids and with adults. And so not knowing how to regulate as an individual was a thing, but then now we've got it compounded with the system. So I'm really passionate about it because, again, it affects us all. And as the Surgeon General says, the well-being of our nation is now at risk because of the situation at hand.
I believe it. I did a little bit of the same, research. I found the Surgeon General's commentary on it. And, the top 3 most stressful jobs in the U.S., healthcare is number 1. And it was a general category. But if you're in healthcare, you have a very stressful job, followed closely by social workers and then fast food and retail. But it's a real big issue. It's more so than I thought. I think 90% of employees say that stress and frustration negatively impacts the quality of their work. Now think about that as it applies to healthcare. I don't really want a stressed out nurse coming to see me and doing their job. How could that influence my outcomes? 57% of employers say that burnout has directly impacted their churn rates. And we already have such terrible churn rates in healthcare. We just have to do something about this. So I'm really glad that you're speaking out about it.
And if I can add to that, it's everything from physicians down all the way. So I think when we say healthcare, we got to remember we talk a lot about nurses and doctors because we're the most obvious and the more numerous and the more, whatever, expensive, I guess. But the crisis goes from physicians who, by the way, physicians and nurses, the suicide rates are out of control. I do want to talk about the mental health piece today because it's awful, but all the way down to our personal, care workers, our unlicensed personal care workers who are the workhorses of helping to take care of this aging population. We need everyone. So I just want to remind the audience that we're talking about the gamut, and especially since this is a home health based show, a lot of home health depends on nurses all the way down to your CNAs, to your unlicensed providers, and they're all sometimes hurting the most even as we go through that chain. So I just want to make sure we're clear on that, that everybody's important here and everybody matters.
That's a really good reminder.
It affects our industry.
It does. Thanks for that reminder. Now, burnout and compassion fatigue. These two terms sound very similar, and I think they could probably be mistaken for one another and used interchangeably. So for the listeners who aren't familiar with this jargon, can you explain the difference between burnout and compassion fatigue? And as a follow-up, how are each of these impacting healthcare workers?
Yeah, thank you for that, because it is confusing. And when we look at signs and symptoms, if you will, they're very similar and they can overlap. So where all of this stems from is chronic stress. So if we look at what chronic stress does to anyone, and here's the bad thing and the good thing. Burnout's getting a lot of attention, not just because of the healthcare effect, but because it's affecting all industries, and America in general is burnt out. So that helps too, right? But at the end of the day, when you have chronic stress that isn't regulated, that isn't being managed well from, different angles, right? Maybe from your ability to cope, more the workplace environment, the organizational piece of it. So burnout is very related to chronic stress due to the system you're working in, your work stressors, your documentation, your workload, whether you've got bad leadership going on, the hours that you're not, able to keep up. Compassion fatigue, in contrast, is more of the burden that happens when you are caring for other people. And this makes us unique in healthcare, right? Because most of us that are clinicians and caregivers, we're kind of wired different. So we have this calling for various reasons, and I could write a book on this, and I might. For various reasons, we're called to help people in need, right? And so what ends up happening is if we are not able to disconnect or have good boundaries and barriers, that chronic suffering that we're seeing, and those of us that work in life and death situations that see, and sometimes it's not even that you're directly caring for someone maybe who's critically ill. Maybe you're exposed to all the stories. So vicarious traumatization is something that is now being studied deeply, because whether you're a healthcare provider, a first responder, a police officer, for example, we've learned over the years that vicarious trauma, the trauma we're taking in and absorbing through the pain and suffering of those that we are working around and with and caring for, it affects us. So in healthcare, we have a double whammy effect. We have the burnout effect because the system is so burdened, right? Where we're short-staffed, we're being asked to spend more than half our time. And that's a big one. We don't get to spend the time with the patients, which is what we signed up to do. We have this burden of all this other stuff. So you've got the workplace stuff, and then you've got the human part of it. And then they come together and we have this double whammy effect. I want to throw in one more term, if I may, because if we have healthcare professionals listening, as I'm sure we do, we have a lot of cynicism around the whole burnout, compassion fatigue in some circles, because they're like, yeah. So a lot of, especially my physician colleagues, they like moral injury to be thrown in there.
Moral injury.
Yeah, because what happens is we're put into this situation where we can't provide care the way that it should be. We're having to suffer through all of this, right? We don't have enough time. And then so at the end of the day, I just want to throw that in there too, because when you're at odds with what your values are versus what you can do, what you have to work with, and what the whole picture is, people end up with that. So I hope I answered what you were asking, because it is very convoluted. Now, the signs and symptoms can overlap. So early on with burnout, we tend to see people getting really cynical, which can be confused with the gallows humor that sometimes we use just to kind of cope with job stress. So a lot of cynicism, disconnect with our job performance starting to go down. And then when you look at compassion fatigue and burnout side by side, it overlaps. So again, the source is chronic stress. And what does chronic stress do to us? it affects our physical health. Our blood pressure might go up. We're feeling crappy. We're not sleeping good. That's a big one. And then the mental health stuff comes into play where we start feeling the anxiety and the depression, and maybe the rumination. And I mentioned suicide because ultimately, it's contributing to that. And there's a 2019, I think, a study that was done right before COVID through JAMA that showed that nurses and physicians have twice the suicide rate as maybe the general population because of that. So, that's a lot.
That is a lot. Thank you for diving into that. And it's a very complex problem. And I can see where a healthcare provider, especially because you guys are definitely wired differently. You're more empathetic, and empathetic people have this ability to absorb other people's energy and the demands on them. And if they don't set healthy boundaries, it can really influence their health. And I was reading about the statistics of the impact on health, and it's crazy. It's 63%. Like if you're burnout or if you have compassion fatigue, you are 63% more likely to take a sick day, and 23% more likely to end up in the ER. And I think this problem is somewhere around $190 billion a year problem for employers.
At least, yeah.
Just for the morbidity and mortality and the healthcare cost.
And that's not counting the impact on our patients, because here's the crux.
Let's not forget about them.
Back to why I'm so passionate about this. This is going to sound really extreme. It's killing people. It's killing the people trying to do the work. Maybe long-term, in different degrees if you look at it. But you just cited great data on the morbidity, the mortality. And this is taking, this is the human factor. There's also the impact on the industry, right? And on the business side of it. But when you've got folks who are suffering from this, burnt out, tired, overworked, all of this, medication errors go up, patient outcomes decline. Patients know they're not getting good care. Nobody's happy with it. But there's no way for us to really measure hard data on how many people maybe totally are affected. But it would be a very, very scary statistic, I think, if we looked at the sides, right, of the health outcomes and what's happening on the caregiver side, and then how it's impacting patient outcomes and things of that nature. It's not good.
It's scary.
And it was really bad before COVID. And a lot of the data that we're looking at is actually pre-COVID. So imagine, because we all know, having thrown the last 3 years into the mix and what's happened, life support for the system.
I think if we look at the statistics next year when they're able to analyze COVID, it's going to be worse. And that paints a very gloomy picture to start us off.
I know.
I want to talk about the solution here, because you've been speaking out a lot about how change needs to happen on multiple levels, on the individual level, on the team level, and the organizational level. Tell me how this looks like in practice.
Well, I hate to disappoint, but I'm not here with the magic answers because I don't have them. The Surgeon General doesn't have them. The National Academy of Medicine sadly doesn't have them. But here's what I will tell you, Erin. I described this analogy of the system as a patient, right, that I saw declining. And I'm describing my experience over 20 something years. So we have to be realistic, and we have to understand that we're not going to fix this problem quickly, instantaneously, because we didn't get here overnight. But the short term, what I believe, and all of what I've been researching in this last year backs that up. We need a culture shift. We need to recreate the culture. And that's where those 3 levels come in, because as individuals, as teams, and as organizations. So even though we're talking, and like you said, this sounds really gloomy and ominous and impossible, every single one of us, actually, everybody, even patients, it's not even just us in the system, because as we mentioned, everybody's going to be a patient. Everybody needs healthcare. We need a complete paradigm shift and a complete culture shift, because what we are experiencing and living in right now simply is not working.
Mm-hmm. So what do you think are a few actionable items for the listeners to consider implementing?
So I'm going to guess that most of our audience is going to be probably home health, companies, leadership, clinicians. Here's what I would recommend and what I've been recommending. Ask a lot of questions. Any of you who have any kind of coaching, training, background, experience, think like a coach and ask yourself the hard questions. What do I need to do as an individual? Because, and here's where my cynical healthcare workers need to take a breath and dive in. Yes, it isn't all about just you taking care of yourself and being healthy, I know, but we need you to do that. So as an individual, I'm responsible to ask myself, if I choose to stay in, okay, what am I doing to care for myself so that I can do this? What boundaries am I setting? Am I choosing to work in a place? Because guess what? The number one reason people leave their positions, and this I pulled from the Nursing Management Journal, I think it was done within the last couple of years, toxic workplaces are still the number one reason people don't stay. So what do I need to do to be healthy and be part of a more positive culture? And hey, I've got choices, everybody, and that can be good. Because if I don't need to stay in a toxic workplace and there's no fix, am I choosing to work at organizations that are trying to do a good thing? Because then everybody's got to make those changes because that's where the nurses and the clinicians are going to go. So your choice matters. So don't be a victim and be stuck in an awful place that you're not helping to fix. So start with yourself and then team. So no matter how small or how big your organization or your company is, we're all part of some kind of team. Here's what the research is showing. Quality, connection, and leadership. How are we working on that team level? Are your leaders on the smaller scale, the bigger scale? What's the leadership like? We know that people want management where they have the ability to have some choices and not be micromanaged. So what's going on with the team and what can the team do for that cohesion? And especially in home health, where it's historically hard for us to find connection because we're out there a lot as Lone Ranger clinicians. We need that for our mental health and our physical health, that connection. And then at the organization, that's where the folks up top need to say, hey, what are we doing to make this a healthy place for people to want to work? What assessments? So here's another piece, all clinicians. There are, if you go to the National Academy of Medicine, just NAM is our website, they have a huge compendium with all these free tools. The Surgeon General's report, I strongly encourage anybody listening in leadership to look up the Surgeon General's advisory on building a thriving health workforce, the report that came out in May of this year, because there are tons of tools and recommendations, and we have to find what works for the culture and the company and the place that we are at. So, sorry, Erin, it's a long answer.
It's a good answer.
We have to get creative. We have to ask questions because you know what? Our solution in a maybe mid-sized home health company is going to be really different than a hospital system solution. And if we don't start having the conversations and acknowledging, hey, we're not okay. How can we be healthier? Taking the stigma out of mental health, out of what we need to do for ourselves, right? So start with the questions and build from there. And, reach out for resources, people that can help you through this. It's not going to be an easy fix, but we do have to take away hey, it's just about you. You can't handle the stress. Okay, bye. Let's get the next nurse, the next CNA. And then the churn continues. Everybody loses money. Everybody's unhappy. The patients are getting crap care. So a lot of questions.
A lot of questions and a big important answer. So from an individual's perspective, you ask yourself those hard questions, take your own responsibility, own your destiny. And then if you decide not to work in that toxic environment, I heard you say something important, which is basically choose a good leader, do your investigation and make sure that leader has your best interest and your well-being at heart. And then take a step further if you're looking for a better environment and look at the organization and look for employee assistance programs and any other programs they might have in place to help people deal with stress. If I were to summarize in a few sentences, did I get it or am I missing a piece of that puzzle?
You did amazing because that's a lot of information to sift through. And it's funny because, when I do talks and webinars and presentations, I've got little visuals about, like the cycle, where to begin and all these angles, different suggestions for tools that can be used. I came across something really interesting last night, kind of preparing for today. And I apologize. I don't remember exactly where I pulled it from, but I thought this was great. So here's a leadership suggestion. if you're going to work on wellness, so listen, if you have a system problem, your EMR isn't working or something's not working with your billing, you're going to approach it as a, problem solving solution. You might get a consultant to help you, for example, or get creative. So what if you had a key performance indicator, a KPI, somehow linked to the well-being of your workforce, because it's that vital. So maybe you decide to say, hey, we're going to use something like the professional quality of life inventory, and we're going to see how we can improve our scores. Or, it's the beginning of the year. This is a fantastic time to start some workplace health challenges. Get people involved at every level, buddy people up. That's a big one that has been proven to help. But it just getting creative and finding out how can we also make it part of what we measure in terms of the health and the vitality and the success of our organization, just like we measure our patient outcomes and our financial outcomes and our, all of our other things. So it's that important.
It is important. It's a little bit tricky when you're trying to measure people's emotions and their physical state, but there are technology tools out there that can help you do that. It can take into account like natural language processing and some other artificial intelligence tools to look at your notes, like a nurse's notes in the house, and habits on the EMR. Are you filling out your notes? Are you completing your tasks? Are you clocking in late? Have you asked for more time off? And produce that KPI that you just mentioned that says, hey, this person might be at risk for churn, or there might be something going on. So you brought in a very important point that in order to address this problem, we might need to lean a little bit heavier on our technology partners to even help us identify where the problem exists in the organization so that we can focus our energy there. And thinking more about the organization, because this is the house. Like it's, if I think on a level, you've got the individual, then you've got their initial like manager, and then you've got the organization itself. This is the one that it has the most responsibility to make sure that there's systems in place to deal with this. What recommendations do you have for these employers who might be looking to improve their workplace morale and make their organization a place where nurses and other caregivers really want to be?
And that's a tough one, because we're at that place, I think, where everyone's in survival mode. And it seems like the answer is too much to reach for, or it's too costly. But I'm at the point where I think we can't afford not to change things. And I love how you mentioned the technology. So to answer your question, what employees want and what nurses want, one is to feel valued, and sometimes just that, I think, outreach of, hey, we're going to use our technology partner, or hey, we have this company that's already doing our insurance, right, and our wellness and our EAP. So, I mean, I've got an app that reminds me to do like these wellness checks on myself, right? Stuff like that. So what are we doing to make people feel valued? And it's not about the junk food and the donuts, guys. Stop doing that. Nurses don't need, no healthcare worker needs more sugar, maybe something for healthy food, but what can help people care for themselves and feel valued? So they want flexibility, easier said than done, right? How can we create a staffing situation? And I know people are going to roll their eyes at this, where people can take their time off, where they can have flexibility. And I have seen some companies get more creative about job sharing and different things, where people can have that, because as healthcare providers, we feel like we can't ever take time off. And sometimes the organization feels like they can't afford us to take time off. So how can we get creative with maybe different from the classic structure? Oh, I need a nurse. I need a case manager full time. That's it. That may not work anymore. So if we know nurses are still, having to deal with like childcare stuff and family stuff from the COVID time, they want flexibility, autonomy. They want to feel, as I mentioned, valued. They don't want that toxic work environment. So if you can go into that high quality connection, so I'll get on my soapbox for a second about this. We laugh that we don't have time for this, but we need it so much. And the Surgeon General, going back to him, it's not even just in his report. He actually wrote a book on this, because his two priorities, the same office that tells us that smoking is going to kill us and stop doing that, not only did he put out this advisory on the healthcare workforce, situation, but also on isolation and loneliness and how that's making us all sick. So if we feel isolated and lonely, even in our workplaces, how can we have those connections? So how can we take moments during meetings, get creative again, ask those questions to get to know each other as people? buddy up, have a combat buddy or a battle buddy. I think that's a program that's been real successful. So what can you do within the organization to make that culture feel more like community so that people want to work there? Because we're all hungry for that connection and that support, but we don't know how to ask for it. And Erin, you mentioned how we're wired different. I think I said that too. We are. If you let us, we're going to go try to fix and save everybody and get through. And so we also, again, have to go back to buying into that. And you have to kind of reel people in sometimes into, hey, yes, we're serious. Let's talk. Let's improve these high quality connections, because that is the lifeblood of any organization succeeding and the people wanting to be part of it.
Those are all very good recommendations. Very good recommendations. And I think you're right. We are going to have to lean more on technology to help facilitate some of these things. Mm-hmm. There are some insightful apps that you can apply to your staff. Like you say, you get your reminders to do a health check. But, just even more broadly, if we are going to continue to experience the shortage of nursing and other care workers, how can we leverage technology so that we're still providing good care, but we're not burning out that caseworker, that nurse? So I think this is definitely going to take a long time to solve. But
and notice I didn't say much. Okay, let me backtrack. People want fair pay, so we do know that people want fair pay, and that's right. And I think we've all heard the stories and have experienced how nurses will go to the high-paying traveler jobs, which won't be around forever. So yes, you have to pay competitively and you have to pay fair, but those sign-on bonuses are not retaining and keeping people. That isn't the solution, at least not long-term. And I know that that's been the big thing, is throw money at it, and hopefully, because we're desperate. So yes, take care of your people financially. Of course, we need that, especially now with inflation. However, that never comes up as the top thing people are looking for. It's these softer things, if you will, that we're discussing. So give that a lot of thought, because you might save yourself a lot of money in some ways, right?
Indeed.
But it's something to consider. Just the bonuses alone are not going to fix this.
Yeah, it's more about the culture. I read some statistics a while back about employee churn and what makes people stay. And one of the top things that made people stay wasn't pay. It was, how does that company make them feel? Are they valued? Do they have the flexibility? Flexibility was a big thing, but are they recognized for their work? So just providing an environment where people can get a pat on the back and, a good job and attaboy and I'm here for you, that goes a long way.
Like we said, we're wired different. So maybe in a different industry, the money would help. I don't know. But yeah, we thrive on feeling we're mission-driven people working in an environment where we want to make a difference. We want to help people get better. We want to help people not suffer. So we get our validation and our gratification from being able to work in an environment that isn't going to make us sick, where we can do that. That's kind of where the answer lies. And it's complicated. But if we can keep track of that's what makes people tick, and that's what's needed, then asking ourselves those questions, okay, great. Then what can we creatively do at our place, at our company, our organization, within our team to achieve more of that?
Absolutely. And for our leadership listening to this episode, be thinking about this as you are setting your 2023 business goals. Be thinking about how you can implement a program or a culture change that is going to make your workplace the best place to work. And you also mentioned along the way that, when people are coming up against some of these challenges, they might reach out to a consultant to help. And I know that Amity Healthcare Services provides a number of different products and services that might be able to assist a company in implementing a program that will improve employee retention. So I have a final question for you. Is how can the listeners connect with you and learn more about this particular topic and the additional services that Amity provides?
So a couple things I'd like to suggest. Obviously, you can reach out. We have our website, amityhealthcaregroup.com. My personal email address is lw@amityhealthcaregroup.com. So go to our website. But I would love to invite you. I have 2 free webinars on the ACHC University website that I put out this year. One is specific to what we're talking about a lot today, the compassion fatigue and the burnout, and the levels to look at that. So if you want more details and suggestions and data, it's on there. You can download it. I did a second one on developing and leading resilient healthcare teams. That one I did a little bit. I've lost track of what happened this year, Erin. I think I did the first one in the spring, and then the other one happened maybe October. But go to ACHC University, ACHCU. I know many of you are familiar with that, where you have all those free educational tools. And it's under the home health at the hospice webinars. Please listen to those. And if anything at all resonates with you, my contact information is there. I invite you to please reach out to me if I can assist you in any way, or even just offer support based on what you heard or answer questions. It is my passion to work with that. So please check out those two offerings. They're free to you. They're full of good information. And if we can go beyond that, here I am.
Wonderful. Thank you so much for joining us today, Lourdes, and sharing your wisdom and your experience. I think it's going to be really valuable for the listeners to hear more about this topic and some ideas for how they might be part of the solution.
Thank you so much, Erin, for opening up the conversation and being part of the solution, because every little bit matters, every single one of us. So this is a way to do that. Thank you.
Absolutely.
Home Health 360 is presented by AlayaCare. First off, I want to thank our amazing guests and listeners. To get more episodes, you can go to alayacare.com/Home Health 360. That's spelled Home Health 360, or search Home Health 360 on any of your favorite podcasting platforms. The easiest way to stay up to date on our new shows is to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. We also have a newsletter you can sign up for on alayacare.com/Home Health 360 to get alerts for new shows and more valuable content from AlayaCare right into your inbox. Thanks for listening, and we'll see you next time.